Welcome to the KanCare Ombudsman Liaison Training. The KanCare Ombudsman Office is here to help Kansas Medicaid applicants and members and those who assist them to navigate the system and resolve their KanCare issues so that they can get and keep their KanCare services. We know that Medicaid can be very overwhelming, very confusing, so we try to create our resources and our educational materials from a beginner's perspective so that members, applicants, and again, those who are helping them can find what they need, understand what they find, and use that information to meet their needs. Here are some of the pieces you will be learning about today. New Kansas resident questions, how to investigate eligibility, programs for families with children. There's 2 children's programs, regular Medicaid and CHIP, the pregnant women program, and also the parent or caregiver program. It's for parents or caregivers caring for a child under 19. We're just going to touch lightly on each subject today, but you can find more in-depth resources and educational materials on the KanCare website in the Ombudsman section. That link is www.cancareombudsman.ks.gov. And again, at the end of this video, we'll provide clear instructions on how to get any of the resources mentioned in this video. Medicaid is a state-run program. It's jointly financed by both federal and state governments. Medicaid differs state to state. Just because a member was eligible for Medicaid in another state does not mean they will also be eligible in Kansas. New residents must reapply in Kansas. Even if they are eligible in Kansas, then the scope of benefits and services may vary as well. So, for example, someone may call and say, I had Medicaid in the state I just moved from, so can you help me transfer my coverage? The answer is there are no transfers of coverage. The individual may or may not be eligible in Kansas. They're going to need to reapply to find out. Another example question you may get is from someone who just moved here from out of state, and they're saying they want to reapply so that they can get those same services and benefits they had in their previous state from Medicaid. Well, again, the answer that they need to understand is that they may receive the same services, but they may not, depending on what they're found eligible for. So they could get different types of services, and they could even get different amounts of those services. New Kansas residents. Applicants must cancel the Medicaid account they have in the state they left behind. As long as they are here and have the intent to stay, they can apply immediately. Don't wait to apply. You just need a physical address and a mailing address. How can I find out if I'm eligible for Medicaid? Well, there's 3 ways to investigate eligibility. You can read through the appropriate fact sheets, and we will go through those. You can complete the online eligibility check, and I'll show you that. And you can apply for KanCare, and that's what we recommend. The KanCare Ombudsman Office does not determine if an individual or family is eligible or not for KanCare services, but we do help people investigate that eligibility, and we're going to teach you how. Fact sheets. So the first thing they can do is review the appropriate fact sheet, and there is a fact sheet for each program that provides an overview of the program and its general eligibility requirements. There's the online eligibility check tool. It takes less than 5 minutes. It's got 11 questions, and it gives you an idea of whether or not you may be eligible for certain programs. It's not a guarantee. You'd still have to apply, and it does have some limitations. There's some programs that you have to make a certain income level, and you're just eligible, you're not eligible, but there's other programs where you could make a higher income and still be eligible, and they're just going to use that income in a calculation to determine what your cost share is for those services, which could be a monthly amount or even a deductible amount. So again, and some of those programs may not show up here, so this does have its limitations. These are the 11 questions that the online eligibility check tool asks, and after you fill all those in, it'll generate an answer of you are likely eligible for these programs or you are not likely eligible for these programs. The third way to investigate eligibility is to apply for KanCare. It is recommended. It's not going to count against you if you apply and you get denied and you apply again a few days later. You can apply as many times as you need to without penalty. There are two ways to apply, by paper or online. If you get the paper application, there are two possible applications. One for families with children. That's going to be for children under 19, for parents or caregivers with children under 19, or for pregnant women. There's the elderly and persons with disabilities application also. That's for people 65 and older, and for persons with disabilities. And that can be any age. And that means with a Social Security Administration determination of disability, or someone who's trying to achieve that. They've already applied for that at the Social Security Administration and they're waiting on that disability determination. There's also the online application. That doesn't matter what age you are or what program you're applying for. It's an intuitive application, so you just type in your answers and it'll take you to the next screen automatically. How do I check my application status? That means contacting the KanCare clearinghouse. Whether you've applied on paper or online, the clearinghouse is the contact for when you're where you've sent your application. It's who you call to find out where your application is in the process. And also it's the place you want to call to make sure they got your application, make sure they also received all the additional documentation that was required in order to process your application. That is your point of contact, the KanCare clearinghouse. Have you made a recent change? If you're a new applicant or if you're a KanCare member and you've made any recent changes, it's really important to notify the KanCare clearinghouse about those changes. The clearinghouse actually requires that you update them with your changes within 10 days for most things. What type of changes need to be submitted to the clearinghouse? You need to let them know any change that's going to affect your communication between your representative if you have one, and the KanCare clearinghouse. If they have to send you a letter asking for more documentation and you've moved and you haven't updated your address with them, well, you're not going to receive the letter and you'll miss the deadline and you'll end up having to reapply. So really important, keeping the KanCare clearinghouse updated with your phone number and your address. Any change that's going to affect a person's eligibility, maybe your income goes up or down, for example, or your assets. Also, any change that would affect an individual's client obligation, patient liability, or spend down. Again, if you happen to be paying more per month than other health insurance, your premiums went up, well, now your monthly premium for the KanCare may end up going down. So it's really important to let them know about any changes. A few examples: no longer need KanCare services. As I said before, change in address and phone number. Or if you have a medical representative that helps you to read and understand your mail, for example, make sure if they've moved or changed their phone number, that is also updated at the clearinghouse. If you've had a change in employment, a change in assets or income, maybe your secondary insurance has changed. If the amount you pay is increased, again, your KanCare monthly premium may go down. If there's been a change in marital status, or a member is deceased, or the birth of a baby, you actually have 30 days to report the birth of a baby. And has someone moved in and out of your home? Or is there a change in guardianship, or change in DPOA, or change in your medical representative? Let the KanCare clearinghouse know of these changes. Medical assistance programs. The Kansas Department of Health and Environment, Division of Healthcare Finance, is responsible for purchasing health services for children, adult parents and caregivers with children under 19, pregnant women, people with disabilities, any age, and the elderly, which is over 65, through 3 programs: Medicaid, CHIP, and Medican. Let's go through these KanCare programs. KanCare is provided to all Medicaid members. Medicaid was created to help the most fragile of our population, who also have a very low income and/or assets and resources, pay for medical necessity. Children under 19, including those who are in foster care or who get adoption support payments, pregnant women, adult parents and caregivers caring for children under 19, and the elderly, 65 and older, and persons with disabilities. This can be a child or an adult, and persons determined blind or disabled by Social Security rules, SSI, which is Supplemental Security Income, or SSDI, which is Social Security Disability Insurance, or trying to get there, meaning they have a pending disability case with the Social Security Administration. Either they've recently applied or they've been denied, but they're actively appealing that Social Security denial of disability. The following populations may also be eligible for Medicaid, but the application they complete is a little different, and it's generally completed at the clinic upon diagnosis of their condition. Persons receiving inpatient treatment for tuberculosis, and persons screened and diagnosed with breast or cervical cancer through the Early Detection Works program. The application for families with children has the programs for children under 19. Both of those children's programs are going to age out on their 19th birthday. Parent and Caregivers program of children under 19, and pregnant women. Children's programs. The state of Kansas offers health coverage through KanCare to qualifying children under age 19 in two ways: KanCare under Medicaid and KanCare under CHIP, which is Children's Health Insurance Plan. When filling out the KanCare application, there's a person 1 and a person 2. If the child is under 18 years of age, they need to have an adult apply for them. So person 1 would be the adult helping them to apply, and person 2 would be the child under 18 years of age. If the child that's under 19 is 18, then they can fill out the application for themselves, so they can be person number 1. KanCare under the Medicaid program. It covers children under 19. Again, you'll age out on the month of your 19th birthday. The child can have other insurance and still be covered by KanCare under Medicaid. Coverage could also be retroactive with this program, which is not true for the other child's program. It can cover up to 3 months before the month of application. So if you applied sometime in March, you had actually needed coverage back in December, January, or February, 3 months before the application month. This program, it is possible, as long as you're eligible, for that coverage to be backdated, retroactive, and cover that time period as well. KanCare under CHIP. CHIP is Children's Health Insurance Program. It covers children under 19 also. Again, they'll age out on the month of their birth date. I believe no matter what date their birthday is on in that month, they'll age out on the first day of that month. Child cannot be covered by any other health insurance and get CHIP. CHIP was actually created for children who weren't eligible under Medicaid and also who don't have other insurance. So a child who has other insurance is not eligible for CHIP. Coverage cannot be backdated. It's not retroactive like Medicaid is, so it can't. You can't apply in March and then get any dates before that covered, any dates before the month of the application. Coverage begins the day the application has been processed. So if it's processed on, let's say, April 25th, then coverage starts on April 25th. Rather than the application month, and again, it's not retroactive. So looking at the two children's programs side by side, regular Medicaid and CHIP, Medicaid has the lowest financial eligibility. Families are allowed a very low maximum income, and there are never any premiums for this program. If you can see the table toward the bottom, it looks at the monthly income limit for a family of 3. So we've got mom, dad, and the child who's between the ages of 6 and 18. The total maximum income the family can make is $19.57 for the child to get regular Medicaid. But for CHIP, families are allowed a higher maximum income. They may have to pay a monthly premium of $20, $30, or $50 depending on the income, and that premium is going to cover all the children in the family. But if you'll look at the difference, let's say the child didn't qualify for regular Medicaid. Let's say the combined income of the family was actually $2,500 per month. Well, then KanCare will run them for Medicaid. If they're not eligible, then they'll automatically run them for CHIP and see if they're eligible for CHIP. And in this case, they would be. Here's one of those fact sheets that I mentioned earlier. It's a great way to investigate eligibility. This one's for the children's program. The fact sheet was created by KDHE, which is Kansas Department of Health and Environment. They are ones that determine eligibility for KanCare, and it gives an overview of both the children's program, both of the children's programs, and the general eligibility requirements for each. These fact sheets explain the income and resource asset rules for the different programs. So when you're reading the fact sheet on the children's program, for example, it'll tell you there is no resource or asset test for this program, but there are income guidelines, and they'll list those for you so you can see what the maximum income standards are. If an individual wants to investigate eligibility before they apply, you can go over this information with them, but the best way to get an accurate answer on eligibility is to apply. The Adult Parents and Caregivers Program. So KanCare is available to adult parents or caregivers of children younger than 19, even if they don't have a disability and they're not over 65. They do have to meet the eligibility guidelines, and the adult and children's benefit packages will be different. There is a fact sheet for the Parent and Caregivers Program. So again, you can see here that there are no resource or asset tests for this, and then again it tells you the income requirements for this program. The income requirements for the parents is much stricter than the one for children. So what happens sometimes is that the parent will not be eligible, but the children will be eligible. It will tell you on the fact sheet if the family income exceeds the maximum income limit for this program, well then the children can still be considered for coverage under the children's programs. And we've seen that happen because again, the income is has to be much lower for the parent or caregiver to also get coverage. And also another thing important to note here is that parents and caretakers approved for this program are required to cooperate with Child Support Services, Department of DCF, to obtain child support for the children in the home. The Pregnant Women Program. KanCare is available to expectant mothers who meet eligibility guidelines. The program offers comprehensive health coverage in addition to prenatal, labor and delivery, and postpartum care. Here's another fact sheet, this one on the Pregnant Women's Program. Again, they're going to give you a bunch of information about eligibility requirements, talks about family size, whose income they're going to be looking at. Are they going to be taking a resource or assets test? They don't, again, on this program. They'll talk about what type of income they're going to be looking at, and then again, they give you the income limits. Where can I go to learn more about Medicaid-related resources, ongoing education, and ongoing support? To find resources we've covered in these videos, and additional Medicaid-related resources, you can go to the KanCare website. The direct URL for the KanCare website is https://www.kancare.ks.gov. Then, once you're on the KanCare website, look for the KanCare Ombudsman section in the toolbar to find the KanCare Ombudsman's webpage. The direct URL for the KanCare Ombudsman's webpage is https://www.kancareombudsman.ks.gov. From the Ombudsman section of the KanCare website, next you'll go to the Resources page. That direct URL is https:// www.kancare.ks.gov/cancare-ombudsman-office/resources. When you click on that resources link on the Ombudsman section of the KanCare website, you'll see listed all the resources we talked about here today, and a lot of additional Medicaid-related resources. Also, on the KanCare Ombudsman's webpage, you can see the KanCare General Information Fact Sheets. To go directly to that URL is https://www.kancare.ks.gov/cancare-ombudsman-office/cancare-information-fact-sheets. When you click on that KanCare General Information Fact Sheets, here is an example of the page you'll see. Of course, we're constantly updating this and updating the information that's there and also adding more. So a lot of good resources here as well. Some of these we've mentioned in the video, and some of these are additional resources. Also, on that KanCare Ombudsman webpage, you can look for the community training link in the drop-down menu. The URL directly to that community training link is http://www.kancare.ks.gov/volunteer-office/ongoing-education. There will be videos. These videos that you're watching right now are posted there, and any updates we do to the videos or added videos will also go on this section. There's also, if you'd like to register for in-person training, you can register for a class near you. If you're a KanCare applicant or member and you're needing help to resolve a KanCare issue, we are here to assist you. Also, if you're a provider assisting someone or a family member or a neighbor and you're trying to help a KanCare applicant or member, we are here to help you also. Give us a call. Our toll-free number is 1-855-643-8180. Again, that's 1-855-643-8180, or email us at kancare.ombudsman@ks.gov.